You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering liposuction or a tummy tuck. With us, we have Manhattan's plastic surgeon, Dr. Daniel Kaufman. Dr. Kaufman, welcome to the program.
Thanks so much.
Now, for people that don't know your center, and you brought a lot of before and after photos, so we'll get to those in a moment. But for people that don't know your center, tell me a little bit about your practice. I guess you have a practice in Brooklyn and one in Manhattan.
That's
so
correct,
who's the
yeah.
typical patient, and what are the different services that you offer?
Well, I'd like to say we don't have a typical patient. We get patients from all walks of life. We get women, men. I get women after babies, before babies, middle-aged, young people. So we see all kinds of different people. But basically, we have people who just don't like the way that they look. They don't feel the same way that they don't look the same way that they actually feel, and they want to improve the way that they feel about themselves.
All right.
Some people are unhappy with different parts of their bodies, the face or the abdomen, the breasts. Whatever the problem is, I'd like to say that we want to help people find solutions to their problems, whether they're real or perceived. We don't want to judge with that, but if they think that the problem is serious enough to come see me about it, then we do everything we can to help them with it. So typically, I guess we could see, let's say, a woman in her late 30s or early 40s that had 2 or 3 babies. She hates the stretch marks on her lower abdomen, or she doesn't like that the way the abdomen protrudes out of her stomach. She can't. She feels like she can't, wear the stuff that the clothes that she used to wear in her 20s before she had the babies. Mm-hmm. I get guys who just can't feel like they can't take off their shirt on the beach, or they can't even go outside and play pickup basketball because all the other guys are going to be making fun of their man boobs or their the breasts that they've developed. And this is a real problem. I mean, we have young guys who just have no personality, or the personality is just hidden inside there and it's waiting to bust out.
So you do everything. I mean, you do facelifts. I mean, today we're talking about tummy tucks and liposuction, but you do facelifts, you do just about everything?
Yeah, everything in the face.
Breast augmentation?
The majority of my work in the practice is breast and body work, so lots of tummy tucks, liposuction, as we said, breast lifts, breast reductions, breast augmentations, Brazilian butt lifts, arm lifts, a lot of post-massive weight loss body contouring. Those are some of my favorite patients to deal with. But I also do a lot of facial plastic surgery. So, starting from the non-invasive stuff like Botox and fillers, chemical peels, and just, the minor little tweaks in the face to help look a little bit younger. And we go to the surgical, the operative stuff, eyelids, nose jobs, otoplasties, ear surgery to correct protruding ears. Neck lifts, so all kinds of different things. Hair transplants, one of my favorite surgeries to do.
Right?
Yeah. So we do a whole lot of different things. And I love all kinds of surgery. There are certain operations I like more than others. Tummy tuck being one of them.
Now you are known for your natural results.
Yeah.
Is that right?
Yeah. Well, here's the thing. I like to say, when people always ask for a guarantee, can you guarantee that I'll look like this or look like that? I never give any guarantees, but the one guarantee I will give you is that you will look natural. Good. You're not going to look plastic. You're not going to look done or made up, or, the beauty of plastic surgery, and this is why my plastic surgery practice is called discreet plastic surgery. The point of doing good plastic surgery is to do something that people wouldn't necessarily know exactly what you had done. You don't want to walk in the street and everyone looks at you and say, "Oh my God, who did that to her? How did he do? Why would he ever do that?" You just want people looking at you and saying, "Wow, you look well rested. You look like
good for their age."
Yeah, like great for their age. I mean, you want to look like you just came back from a vacation and you're well rested, and you just look younger and fitter and fresher. But we just can't tell exactly what that is. So that's the kind of surgery I like to do. Something
discreet.
That's discreet.
And you
natural.
called even the discreet tummy tuck, and we're talking about tummy tucks today. That and you say that you're the belly button, self-proclaimed belly button master or something like that. What is it?
Well, here's the thing. The belly button master. I kind of invented that little term, but we all do low, and when I say we, I mean board-certified plastic surgeons who are educated and trained in doing the proper tummy tuck techniques, because there's a few techniques out there. So we all have been doing lower and lower incisions, and the reason why is obviously people want to show off their belly. I mean, one of the most fun things to do is to go out there with low-cut jeans or a bikini, nice, a top that kind of shows off your belly, and a nice flat belly is sexy at any age. I don't care how old you are.
All right.
Now, if you hide the incision low enough under the jeans or the bikini, the only thing that is left out there for people to know that you had a tummy tuck is the belly button. And if you have that big protruding belly button, that little donut, as I like to call it.
So that happens in tummy tucks?
All of the time. And, unfortunately...
Not in yours, you say?
No, not at all. Well, we'll take a look at a few of mine, and I'll show you what I mean by that discreet belly button.
It's good that you're proud of your work, by the way. I'm cutting in here, but when you were showing me in the green room some of these photos, it was like you were showing me baby pictures.
Yeah, yeah. Well, I mean, it's... I'm proud of what I do. It's a passion of mine. So this is like a labor of love. When I look at a person who comes into my office, I think there's the initial kind of process where sort of like an artist takes a look at or a sculptor takes a look at a big piece of rock, and he or she knows what he can bring out of that piece of rock. He knows exactly where he could chisel down a little bit more.
So you see the end?
That's what I do. Yeah, that's what I see. Right. So I see the end result, but it's not only about the anatomical results, because the pictures can, they can tell, well, they can show you what you've done, on a superficial basis, but it's deeper than that. For me, I like to see what I can do in terms of the transformation in these people's lives. Okay, so people come to me. I can see that their personality is a little subdued. It's a little reserved. They're just unhappy with the way that they look.
Like a self-esteem problem?
Absolutely.
Kind of
I mean, I have women. It's funny when I talk about in the office in a consultation, I have to show you what it is that we're going to do. So here's what we're looking at. Here's where the incision's going to be, and this is what we can expect afterwards. And this happens all the time. I have women who just can't look in the mirror, and I'm really showing them and I'm telling them, look, you have to look, because you have to understand what it is that we're.
They won't even look at themselves.
They don't even look at themselves. Yeah, and they have a real problem with that, and that's a sad situation when your whole life is changed just because you just don't like the way that you look, and it's hard. I mean, it affects every aspect of life. Your social interactions with friends, with family. I mean, you don't want to go out there and put that tight shirt on to go biking with your friends, because you don't want to get made fun of. And I mentioned the guys who don't want to go out there and play ball with their friends because, well, they're just afraid of being made fun of. So I get these stories all the time. People who just can't live that fulfilled and normal and healthy life that they should be living. And once we go through that transformation, boy,
they change.
It warms my heart. It's that's the real fun of plastic surgery. That's where I get my kicks, is to see the patients come in afterwards, a few months after, a year, or a few years after. They come in, they give me hugs, and that just makes my whole, forget the day, it makes my whole year, because I really see that their lives are changed. They have better relationships with their family, with their friends. They're out there and they're exercising. They get the activity that they need in their lives, because now they feel like they have the body that they were meant to have all these years, the body that they really deserve, and they can do wonders now. So they get into different relationships with their loved ones.
They tell you this on the consult?
All the time. Yeah, I get these stories every day.
Like on the follow-up, they come back and they want to give you an update of how their life is improved?
Yeah, they want to tell me how their sex life is better, how they're now dating more, they're out there on the scene, and just, let me show you a couple pictures, and I'll tell you exactly where
people need to know, today we're talking specifically about tummy tucks and liposuction, and one of the things you told me on the phone is very interesting, maybe even made me a little self-conscious. You said, look, the abdomen is the focal point. Elaborate on that.
Everyone sees your belly. I mean, when you're naked, in clothes, it's really hard to hide a big belly for women and for men. And out here in San Diego, the warmer it is, the less clothes you have to wear, and the less clothes you have to to kind of hide that belly. So a belly is important, and as I said before, a flat belly is sexy at any age, whether you're 20 years old or you could be 60, 70 years old. That's something that we all want, and we all want to show off, and we got it.
Okay, good. Now, you brought some photos. What are we looking at here?
So, here's this first lady I want to show you here. So take a look at her. So this is someone that, we see fairly typically. Women, this is a lady in her early 40s, had a couple of babies, She tries to take care of herself, but it's hard, with 2 jobs and 2 kids. Life gets a good hold on you, and you find yourself that you don't eat right, you don't get the proper exercise that you really need, and that's where we are. So she hates everything about it. This is a typical woman who really just couldn't look in the mirror as we're in our preoperative consultation, and I'm kind of showing her, look, this is what the problem areas are, and this is where the incision is going to be. She doesn't even want to take a look at that because she just hates the way that the abdomen...
So with this woman, why not just liposuction? And when is liposuction not enough and it has to be a tummy tuck?
Right. Well, she was offered liposuction by a few colleagues, and that would have been a mistake. And the reason why is because liposuction is something that's completely different than a tummy tuck. Now, I always recommend to my patients, go to a board-certified plastic surgeon, someone that could do the whole gamut of cosmetic surgery procedures, and they can tell you what the exact right procedure would be for you. Okay? And we always have to tailor that to the specific condition. Liposuction on this lady would have been a mistake because it would only have taken care of some of the fatty tissue underneath the skin. But looking at the pictures, we can clearly see the problem is not only fatty tissue, but excess skin. So
like an overhang kind of thing.
Yes, exactly. What we call the pannus, or that lower part of the abdomen, right between the belly button and the pubic area, the private area. Liposuction done there could have even worsened the problem, because if you would have taken care of some of the fatty tissue and sucked that away, what would be left behind is this overhanging apron of skin, or this kind of pouch. And everybody hates that, women and men. So liposuction was not the right option for her without a tummy tuck. And we combine liposuction with tummy tuck, which we do often. And what do you have here? This young lady, she had 2 babies. And what happens often with women who have babies is the abdominal musculature underneath the fatty tissue of the abdominal wall, it tends to stretch out. Okay? And that stretching out creates a little bit of a bulge. Sometimes we call it diastasis. Other times we call it a hernia. It depends on the specific situation. But it contributes to this bulging kind of look to the abdomen. It's sort of like the beer belly, or that masculine kind of masculinized belly. And women hate that. So one of the things that we do in a full tummy tuck is we tighten up the muscles, the abdominal muscles, the same muscles that we see on the big football players, the 6-pack muscles.
So what, you bring them together?
Absolutely, yes.
Like a girdle in a way?
Yeah, it's essentially an internal girdle that we do with some nice permanent stitches that stays there for a long time. And I also, I always kind of tell my patients, you're going to feel like you did 10,000 sit-ups by the time this is done. And it's really going to flatten out your belly. We add to that the taking away of that lower abdominal pannus, doing some liposuction to contour the flanks and the upper abdominal flap. And here's the after. I mean, you tell me. Tell me what you think of this. So, yeah. I mean, not to brag here, but I mean, we really just changed the look, the whole look of the abdominal wall. And obviously she's wearing the age-appropriate bikini over here. And the scar is placed, the incision is placed low enough so that we can hide it with that nice little bikini. But again, that issue with the belly button. Now, had she had this big old donut that I'm talking about, some of the donuts that I've fixed before and that we see
So just liposuction alone also would have left her with an unusual belly button, is what you're saying?
Well, it would, yes, essentially, because if you suck away the fat, what happens to the excess skin? Well, it tends to droop even more, and she would have had a really unsightly kind of belly button as well. So what we did here is we did a full abdominoplasty with taking away of the bottom portion of the abdomen, that abdominal pannus that we spoke of. We also did liposuction on the upper abdominal flap and the flanks. We tightened up the rectus muscles, or the abdominal musculature, made the scar low enough. We made that nice, discreet little belly button. That's the whole point, Randy, of course. Yeah, and again, if you look at that belly button, it just looks like a natural, any kind of belly button that she got from birth. And it doesn't protrude. It's not a telltale sign that, oh, look, she had a tummy tuck. I mean, this lady had a complete transformation in her life. She's a lot more active socially, going out with her friends, going to the movies. I mean, doing all that stuff that you're supposed to be doing at that age. And, when you're unhappy about the way you look, it really affects everything about your life. We changed her around. And this lady, every time she comes into the office, she gives me a nice hug. And like I said, that makes my whole year when someone comes in and gives me a hug and I see that they really changed in the way that they live their lives. And all we had to do for that is do that surgery. So you know, before we did the surgery, when she came into my office, she just wasn't wearing any kind of clothes that are complementary to her. They just didn't bring out any of her womanhood, of her femininity. Now, after the surgery, you can imagine what she looks like in the tiny little black dress, or the different.
So it's like perfectly flat.
Yeah, completely. I mean, and she had to buy a whole new wardrobe for that, for her new social outing schedule. And I mean, it's a transformational process. She now is, she's a completely different person. I hate to, say it in those kind of cliche terms, but it does pertain, and it really is the way that,
So this is not for everybody, obviously, and we've discussed this, but if you hate your abdomen, then do something about it?
Yeah, and it's funny because most people...
But are there that many people that hate their abdomen?
I think almost every woman that you see out there who's had a few babies would, behind closed doors, she would tell you that absolutely. I mean, babies do a lot of, they do a lot of, damage to the body, and this is unfortunately what we have to put up with. Let me show you another one here. This is another young lady. She's 52, 52 years old, so she's still young in my book.
That's got to be unusual.
Well, it's not unusual to me, but it's funny because people don't even know that these kind of problems exist. There's a good reason for that, is because the women who have these problems, they just hide it so well. They've learned over years to disguise all these things with baggy clothes and just, never turning the lights on during intimate kind of behavior, not doing the things that they should be doing.
And this is a 52-year-old woman, because that's an older-looking abdomen.
Yeah. Well,
just after children, or?
Yeah, she's had a few babies. She's she's in her early 50s, and she's actually a very good patient because she's done so much with using diet and exercise, the two words I hate the most, into getting to this kind of state. But as you can see, she has a lot of excess skin, this overhanging pannus that she just hates. So when I first saw this young lady, when she took off her clothes and we saw her in the office, I knew this was going to be a home run. I mean, this is a great patient who's motivated. She's done so much already in terms of getting to her proper weight. She lives an active, healthy lifestyle. But this is the big $1 million problem over here that this still holds her back on a daily basis. Here's what I did. Full tummy tuck, no liposuction on this one, because she didn't have it. If you look at her flanks, they're actually pretty, she's done so much work to get to this situation. But again, the major problem here is that excess skin, that ugly, wrinkled skin with the stretch marks.
I mean, you
get rid of it.
Okay.
Right. So what we do is we make our incision as low as possible, again, so we can fit it under the bikini line or those low-cut jeans. We take that abdominal pannus, the lower part of the abdomen, right below the belly button. We discard of it. The rest of the upper abdominal flap, we loosen up, and we help pull it down to meet that lower incision. Beneath that, we have the abdominal musculature, and if that's loose, again, depending on your specific condition, we take those stitches and we tighten up those muscles. And that really gives that feel of doing 10,000 sit-ups, really flattens out your belly. And I'm going to knock your socks off now, Randy.
Goodness.
Here's the after. So, let's take a look at these results. I mean, on the oblique and the side view here, she couldn't wear any kind of dress or anything that shows off her femininity without having to tuck everything in and wear a girdle. What we did for her on that after is essentially we gave her an internal girdle. We tightened all the muscles on the inside, gotten rid of all the excess skin, and she's got a perfectly flat abdomen. In her early 50s, I mean, this is a total transformation. She can now wear any piece of clothing that she wants. She goes out with her husband now. I mean, this is a much more active, happier young lady that, just is now, only now, has gotten to this point where she feels so confident that she can do anything in her life, and she's showing it off. I always like to tell my patients, I sound like an old graduation speech, this isn't the end, this is the beginning. And it's true. Because of this tummy tuck, she has now transformed her life. Now she has a better relationship with food. She eats a lot better. She watches what she eats. She eats less of everything because she doesn't need
to keep it there.
Yeah, absolutely. And she, as I said, she lives a better lifestyle. She isn't afraid now to go on that bike ride, to go on that walk on the beach, or even just going out to the movies with her husband and her family. I mean, now she's doing a whole lot more than that. She's choosing the stairs rather than the elevator or the escalator. She's really changed her life in terms of her thinking that, wow, now we've gotten so far into getting these surgical results, now we got to keep it and do everything so that this makes it into a long-term proposition. All right, let me show you another patient. This is a fairly common problem as well here.
Wow.
So take a look at this abdomen. So this woman came to me in my office. She's 38 years old, had 2 kids, and she just hates the way her abdomen looks. And this is what she described to me. She thinks that it looks like the beer belly of a man. I mean, these are her words, not mine. And look at the umbilical hernia there. That protuberant, what we like to call an outie, is actually a hernia. So for her, I offered a combination of a full tummy tuck with liposuction of the abdominal flap and the flanks, and an additional umbilical hernia repair. Now, when you take a look at the afters, this is going to really blow you away, Randy. So take a look at that. Now, here's what I'm going to tell you about this picture. So, first of all, the incision is really low enough so that it could be hidden by the yummy tummy underwear there. And this is the typical stuff that she wears, and a lot of women wear this.
I mean, that's a transformation. I'm not trying to side with you, but this is really it's an amazing thing. And you're saying these type of abdomens on these before are common. I mean, they're all over the place in Brooklyn, all over the place in Manhattan.
This happens all over the place.
And there's a lot of women that hate this and are doing nothing.
Yeah, I think no woman likes this. Everyone who has this kind of condition hates it. And you know, it's a sad thing to say, but a lot of women wait so many years before they ever actually get to do something about it, before they have that motivation to get into the plastic surgeon's office and say, yes, this is a big problem. I want to solve it. I want to do the surgical procedure that's necessary to solve this. And looking at these pictures, I mean, we just did a total transformation on her.
Now, we are running short on time, and I know you have some more photos, but we haven't talked a lot about your surgical skill. And you said that you're always learning, always going to continuing education.
Yeah, well, that's part of also the board certification process, is the requirements for continuous learning. You know, a lot of us plastic surgeons, we're always on the phone with each other, always sending pictures to each other, you know, just asking, hey, what would you do about this? And what would you do about that? And that's how we all get better at our craft. You know, I like to say that plastic surgery is the ultimate culmination of science and art. It's an art that you get to perfect and refine over years in a surgical career.
So you feel like you're at the top of your game?
Well, I think I'm at my peak as a surgical technician with my skills, but I think I'm always refining my technique, and I think I learn from every case. And yes, I do get better with every tummy tuck that I do. And yeah, I like to say that my last tummy tuck was my best one.
Okay. Now women are worried about scarring and incisions. Right? I guess everyone would get this done if they weren't worried about the incision. Yeah. I mean, does that come up every day? Is that the fear?
Absolutely.
So speak to that for a moment.
Well, that's the number one fear that people describe to me, is that they're saying, well, I want to get this done, but I just hate the way that the scars look. What if I'm going to scar poorly? And you know, another one of my cliches, I like to say, to make an omelet, you got to break some eggs. So we have to accept that there are going to be certain scars. Now, the beauty, the magic of plastic surgery, as I like to say, is not in doing things without scars, but in hiding those scars in inconspicuous places so that the results can be shown without everyone seeing the scars. And that's that's where the refinement in plastic surgery comes in. So yes, we do have to take some incisions and scars along the way, but if they're well placed in the correct locations on the body, then yeah, the results could be remarkable. And yeah, we can not, so a lot of times we don't even notice the scars. And that's, really when plastic surgery is done right.
Time for a couple more. What else do we have?
Great. All right, here's another one. And, I could go through a few hundred more of these. And this is just another combination of full tummy tuck with the excision of the abdominal pannus at the lower level, a liposuction of the abdominal flap, the flanks, tightening of those muscles, creating the scar as low as it could be, creating that nice discreet belly button that you can show off to all your friends on the beach. And, I got loads of these, and I know we can't go through all of them.
Now, men. Yeah. More and more men are getting this done. You say because of what? Weight loss surgery, massive weight loss, things like that?
Well, plastic surgery isn't for the Upper East Side Manhattan debutantes anymore. It's for the masses. It's for, everyone wants to change a little bit something about the way that they look. So do I, so do you, I'm sure. It's just a matter of coming to that age, coming to that realization in your life and saying to yourself, you know what? I'm done with this. I'm done with living with this body that I hate. I really want to just grab life, by the horns and change the way that I look, change the way that I feel. and by that, change the way that I act. I'll show you. I brought over a picture of a young man that I just did. This is a very motivated young guy. He's 23 years old, was living in a body that really didn't belong to him. He was massively obese, just morbid obesity, more than 100, 150 pounds over his ideal body weight. There's a lot of guys like this walking around, and you would never even know it because they're wearing the big baggy shirts and the big baggy jeans to hide all this stuff that's going on underneath. And there also, it affects the way that they live. They don't go out and get the exercise. They don't go out to play ball with their friends.
The beach,
they don't go to the beach. They're afraid of taking their clothes off in the locker room, in high school, in college.
So on a consult, what does this person say? Like, what's a typical question to you?
Well, he says, "Doc, what can we do about this part of my body?" He says, "I hate the way this looks. This looks ugly to me. I can't take off my shirt in front of a young lady or anyone else that he chooses to be intimate with." And this really just hampers his whole lifestyle. Now, take a look at the after over there.
Whoa.
And this guy just completely, just changed the way he feels, changed the way he acts in his daily routine.
So what did you do? I mean, you did the chest with liposuction?
So we did the chest with a combination of liposuction and excision of the actual breast gland. That's gynecomastia, which I love to do. Absolutely,
okay.
Yeah, through a direct incision. So we did a combination on the chest, but we also did a male tummy tuck, which I do fairly often these days, and a lot of people don't want to either admit it when they get it done, or we just don't even know about these cases. So when this guy comes in, he just he tells me about what he's doing in his life. He's just completely changed himself. He goes to the gym all the time now. He lifts weights. He wears a lot tighter shirts.
He could probably tuck in his shirt now.
Yeah, and he tucks in his shirt into his pants, and he's got a nice waistline. He wears shows off his belts, and he's just not afraid anymore to be out there in those social situations. This guy's really undergone a major transformation in his life, and he's one of my best projects.
We are out of time. Great stuff, by the way. Great photos.
Thank you.
A woman watching this, or man, but a woman watching this, and maybe they're still worried about the incision or the downtime, but they don't like their abdomen. What do you say to them?
I say find a board-certified plastic surgeon, someone who you can, someone you can work with, someone you have a good rapport or relationship with, and just talk. Come in for a consultation and talk about what the options are. Maybe a little liposuction is all that you need. Maybe a full tummy tuck is the right thing for you, but you have to know about all the options and make sure that you can enter into a working relationship, because that's what it's really going to entail, into getting the final great results that you want and changing that life that that you've been living. So that's what I'd recommend.
I want to thank you for coming on the show.
Thanks so much for inviting me. It's a pleasure.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.